VOXZOGO is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates. VOXZOGO may cause serious side effects, including a temporary decrease in blood pressure in some patients. To reduce the risk of a decrease in blood pressure and associated symptoms, dizziness, feeling tired, or nausea, patients should eat a meal and drink 8 to 10 ounces of fluid within 1 hour before receiving VOXZOGO. Please see important safety information at the end of this video.
Annika was diagnosed with achondroplasia when she was about 5 months old. And from the very beginning, my husband and I were committed to talking to her very openly about her condition. From the time she was conversational, we explained to her that her bones grew differently than those of other kids. I vividly remember having a conversation with Annika when she was about 3 years old, when she asked me when she was going to be quote unquote long, like her friend's big sister.
Hi, I'm Annika, I'm 14, and I have achondroplasia. I like to surf, skateboard, and create art. I've recently gotten into thrifting because I find it's like a cheap way to find clothing that no one else has, and it's really unique. I've recently been finding a lot of jeans, which is pretty rare. Finding jeans that fit me is nice.
Annika is very artistic. She always has been from a really young age. She's always drawing, painting, doodling. You'll always find her at the counter with a scrap of scratch paper, drawing figures, whatever it is. So when Annika was really young, I spoke to a friend of mine who had just been to see a dwarfism specialist at Cedars-Sinai. I was able to make contact with Cedars-Sinai and in fact scheduled an appointment for Annika there just to try and find out more. When I first heard about VOXZOGO, my husband and I had a long discussion and decided that it was definitely something we wanted Annika to be a part of, if possible. And we did everything we could to prepare her for the fact that she was going to receive a daily injection. We involved Annika in the discussion about the treatment every step of the way. But at a certain point, it became a decision that my husband and I had to make. We never wanted to give her any false expectations about achieving height. We just tried to stress that we wanted to do everything that we could to ensure not only that she might grow, that also that it was something that we were doing for other kids like her. Annika started on treatment when she was 9 years old, so, pretty understandable. She was scared and didn't love needles. We really emphasized making it quick, using breathing techniques, petting the cat, anything that we could come up with to try and distract from the discomfort of it.
There's not a lot of preparation, but I just kind of get through it, I guess.
VOXZOGO is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates. The most common side effects of VOXZOGO include injection site reactions, including redness, itching, swelling, bruising, rash, hives, and injection site pain, high levels of blood alkaline phosphatase shown in blood tests, vomiting, joint pain, decreased blood pressure, and stomach ache. These are not all the possible side effects of VOXZOGO. Please see important safety information at the end of this video.
We measure Annika's height at home with a measuring device, and we don't measure her a lot, but every so often we'll say, hey, why don't we go measure you? And we'll go upstairs and we'll see how much she's grown, and it's been a fun way to measure her progress. Now at 14, she feels much less anxiety and is much more an active participant in the process. She doesn't remind me that she hasn't yet had her injection, but when I tell her it's time, she's willing and participates.
If I met someone that was interested in taking the medication, I would definitely recommend them to take the medication.
My advice to parents, trust yourselves, trust your instinct, and know that you have the ability to figure it out, and you can find the answers that you need. Starting treatment is definitely a commitment. It's not an easy fix. It's not an overnight solution. You really have to commit to it and be on board, and as much as possible have your kid on board, have the whole family on board.
VOXZOGO helps me grow.
Important safety information. What is VOXZOGO used for? VOXZOGO is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates, epiphyses. VOXZOGO is approved under accelerated approval based on an improvement in annualized growth velocity. Continued approval may be contingent upon verification and description of clinical benefit in confirmatory trials. What is the most important safety information about VOXZOGO? VOXZOGO may cause serious side effects, including a temporary decrease in blood pressure in some patients. To reduce the risk of a decrease in blood pressure and associated symptoms, dizziness, feeling tired, or nausea, patients should eat a meal and drink 8 to 10 ounces of fluid within 1 hour before receiving VOXZOGO. What are the most common side effects of VOXZOGO? The most common side effects of VOXZOGO include injection site reactions, including redness, itching, swelling, bruising, rash, hives, and injection site pain. High levels of blood alkaline phosphatase shown in blood tests, vomiting, joint pain, decreased blood pressure, and stomachache. These are not all the possible side effects of VOXZOGO. Ask your healthcare provider for medical advice about side effects and about any side effects that bother the patient or that do not go away. How is VOXZOGO taken? VOXZOGO is taken daily as an injection given under the skin, administered by a caregiver after a healthcare provider determines the caregiver is able to administer VOXZOGO. Do not try to inject VOXZOGO until you have been shown the right way by your healthcare provider. VOXZOGO is supplied with instructions for use that describe the steps for preparing, injecting, and disposing VOXZOGO. Caregivers should review the instructions for use for guidance, and anytime they receive a refill of VOXZOGO in case any changes have been made. Inject VOXZOGO 1 time every day at about the same time each day. If a dose of VOXZOGO is missed, it can be given within 12 hours from the missed dose. After 12 hours, skip the missed dose and administer the next daily dose as usual. The dose of VOXZOGO is based on body weight. Your healthcare provider will adjust the dose based on changes in weight following regular checkups. Your healthcare provider will monitor the patient's growth and tell you when to stop taking VOXZOGO if they determine the patient is no longer able to grow. Stop administering VOXZOGO if instructed by your healthcare provider. What should you tell the doctor before or during taking VOXZOGO? Tell your doctor about all of the patient's medical conditions, including if the patient has heart disease, cardiac or vascular disease, or if the patient is on blood pressure medicine, antihypertensive medicine, if the patient has kidney problems or renal impairment, if the patient is pregnant or plans to become pregnant. It is not known if VOXZOGO will harm the unborn baby. If the patient is breastfeeding or plans to breastfeed, it is not known if VOXZOGO passes into breast milk. Tell your doctor about all of the medicines the patient takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You may report side effects to BioMarin at 1-866-906-6100. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. Please see additional safety information in the full prescribing information and patient information at voxzogo.com.